I'd like to welcome our second guest on the program, Rob Cavanaugh, President of Field Operations with Accolade, one of the leaders in really on-demand healthcare concierge. And we're going to be really talking about one of his surveys today. But hey, Rob, good morning and welcome.
Good morning. Thanks for having me this morning.
Hey, I understand you're here in Atlanta as well, right?
I am enjoying the nice weather as well that you guys are enjoying from last evening and this morning.
Yeah. Anyway, nice to have you on the program. Before we kind of dive into this latest survey that you guys did, Harris Poll survey, give our audience a little better background on Accolade, please.
Sure, thanks. And so, Accolade was founded on, if you start all the way back, it's founded on this idea that, and it ties into a lot of the topics actually that you guys have been talking through this morning, but the best way to help individuals and their families get the best care and to avoid, challenges or costly mistakes that happen along the way in healthcare is you got to design a service around them. And so, we've designed this service and come to market with something that is focused exactly on the consumer. It's focused on helping them throughout their entire healthcare journey, regardless of the entry point. And so we have these fundamental principles that we operate by in this service. So we believe the solution's got to be delivered to the consumer in a highly personalized manner. And so context matters in healthcare. And so a lot of the solutions, a lot of the technologies that you see in the marketplace today don't necessarily bring that context forward as they engage the consumer. And so it's an important part of the way we engage. You got to deliver it from a service and technology perspective. And so consumers will engage in different ways. So just delivering a technology solution or just delivering a service doesn't really address the entire issue. And so we believe you can't leave it to the consumer to try to find their way through this process by adding another phone number, adding another mobile app, and having those technologies and those services not having the proper context. And so this combination's got to be applied across their entire journey, not just points that they enter the system. And the thing that I believe we also add to this outside of the technology and the service and the context is we build this behavioral science model methodology into our technology and service that allow you to significantly improve the experience, the outcomes, and the cost. Yeah. And so we've reinvented the consumer engagement model through this on-demand concierge model.
Rob, and I think, to your point, you can't just turn the light switch on and expect everyone to be a instant healthcare consumer, can we?
You can't. And what we're doing, it's really interesting as we get into some of the Harris Poll findings is the customers, the employers are spending all this money to launch these different point solutions for their employees. They're spending a lot of money to try to help them, and the consumers are getting lost in that focus because what happens when you enter healthcare? You're thrust into it typically. You're scared, confused, and the last thing you're going to remember is some mobile app that was launched 6 months ago that might help you along the way. Yeah. So you've got to guide them through that journey.
Yeah. So tell us a little bit, because I think this Harris survey kind of exposed a lot of that. So talk a little bit about that, if you would, please.
Yeah, I mean, the Harris Poll, while the information wasn't totally surprising to us, some of the findings, it basically kind of reconfirmed things that we know, that the consumers are confused in use of the healthcare system. They don't know where to turn. They're not able to really manage that. And, they're provided a whole bunch of tools and services. They don't understand how to access them. And so one of the percentages of engagement that I found fascinating is 32% of the people have difficulty or are uncomfortable accessing the healthcare system versus 25% buying a house. And so the consumers are telling you, I'd rather go buy a house than access the U.S. healthcare system today.
Yeah, well, first of all, we've got an industry that's filled with a jungle of acronyms, don't we? That means something to we in the industry, but to the consumer it means nothing. Correct? I mean, it's a confusing jungle
Correct.
of acronyms.
I mean, yeah, and you think about that example even on buying the house. The way I think about it, if you're buying a house, you have technology you can use like a Zillow or something else out there that would help you understand what's for sale, the market, so forth. Right? But then you can engage a realtor that'll kind of walk you through getting a loan, finding somebody to do a home inspection, all the details of that whole process. And so that it's improving even on the real estate side, but that same level of consumer engagement hasn't existed in the healthcare side.
Yeah, and to your point, we're hard at work developing all these resources out there, but that creates kind of a cloud of confusion for consumers too. And I don't think we should be surprised about, to your point, you weren't surprised either. I don't think we should be surprised at this. We're just on the beginning journey of, creating, healthcare consumers and educating and helping them make these right decisions. I mean, we're relatively new on this path. Wouldn't you agree?
Yeah, I would agree, and I would agree that it's inspiring to see the level of innovation that's going on in the hospitals and the doctors' offices and, the technology that's coming into the market. I mean, it certainly is going to improve over time. We just have a fundamental belief that you got to tie all this stuff together to make it work effectively for the consumer. And I want to see more innovation coming with the consumer at the center of it, and not just at the center of it, but all the way through their healthcare journey.
Yeah, I would agree with you. In the survey, you actually broke it down into some life stages too. Can you talk about that? I mean, we talk a lot about how millennials are going to change healthcare, but we don't want to eliminate all the other different workers in their life stages. You talk a little bit about that, if you would.
Yeah, as we began digging into the data, we wanted to know more about the different groups of data. And so the young workers, which we categorized as averaging under 30 years of age, had the least comfort and knowledge in navigating the healthcare system of all the life stages. That in itself is not totally surprising that the youngest entering in because they don't have the experience. But I think if you put the lens of what you guys were even talking about earlier today of the millennial groups, they're social, they like to collaborate, they're open to change, they embrace technology. Coupling that with the amount of innovation happening in this space, they're still confused and they're still frustrated. So not surprising, but again, a little bit more when you put the lens of millennials on it. Then you have the working families, average age about 39, second lowest positive rating of overall benefits and healthcare experience at 42%. So working families are spending a significant amount of time dealing with health issues than even the younger population. And I think part of that might be their parents and their kids still engaging them, and asking for assistance in healthcare and understanding how to navigate it.
So when you're working with your employer clients, or even those that you're embracing to become your clients, I mean, how do you, what do you work with them on around this information? What do you want them to see and embrace with this type of information?
I want them to understand the impact of the investments they're making to us as you think about all of those investments. I think about this survey, and if I'm sitting in running a human resources department or even a company, that you need to turn to, are we really being honest about all of the tools and technology that we're using today? We see these 50-cent solutions, $1 solutions. There's so many of them hitting the marketplace today, and people are testing them because they want this to be better for their employees. But I think you have to be honest whether they're really working, because our engagement, when we look at the whole healthcare journey and how the consumers are using it, we're not seeing deep engagement of those technologies. We think you got to design and deliver healthcare services based on the entire healthcare journey. I talked about this at the beginning. It's not just about a price transparency tool that you use. What happens after you get your second opinion? What do you do with that data?
Right.
The consumer is going to be confused. All right, I have a differing opinion. What do I do with it? They want to talk to somebody. So you have to have this blend of services and technology to be able to consume it. And you need to guide the consumer through every step of the process, and you need to know that population. The differences in the way millennials think, the differences in the way the working families think in this process is super important. I often describe, I come from a technology background, so I love the use of technology to solve problems. But the ability to engage with the consumer and engage the right way is going to uncover different information. And we had a person call into our concierge line asking to refill a prescription for their daughter. And our health assistant continued to ask questions. How are you doing? What's going on in your life? And what gets uncovered is this mom who had lost her daughter 18 months ago had gained over 150 pounds, was about to enter into the healthcare system in really a difficult spot. Your mobile app and your price transparency tool and whatever technology you deliver is not going to uncover that. So you have to have this blend of technology and services to address the whole person.
Yeah, it makes a lot of sense. What else did you find interesting from the survey that you might want to talk to our audience about today?
You know, I think just overall the state of the environment. So we think it's necessary for people to understand the demographic, which I talked about. The days of the primary care physician being your center point and trusted source of information, we think are gone. And it's not because they don't want to. They don't have time to engage and understand every textual barrier. And so the data is screaming out. Their employees, the consumers need help. They need someone holding their hand through the entire journey, and they're frustrated with the services they're delivering.
Yeah. Great discussion, Rob, and really enjoyed having you on the program. I want to give you an opportunity to leave our audience with a couple key takeaways, if you would, please.
Sure. I would go back to the same premises that I started with, that to address the challenges and to embrace the technology and innovation that exists in the marketplace today, you have to have something that's consumer-focused. You have to have something that creates and delivers a blend of technology and services to do that. And you got to understand the demographic of your population and how they want to interact. And you need to meet them where they are in the process, whether that's via mobile app, whether that's via telephone call. And the last point I would leave you with is the importance of context in healthcare, because I don't think we spend enough time today on it. I think we've built a foundational model that have driven some incredible results across our population. 70% engagement. We're addressing 90% of the spend. You know, we have incredible satisfaction ratings. Almost 1 million users on our system today. And we have a 98% employee satisfaction rating.
That's good stuff, Rob. If a listener wants to get in touch with you, how can they reach you, please?
Yeah, you can just go to our website, www.accolade.com, and there's links right there to talk to us directly or submit a request if you prefer to do it via technology.
Great, Rob. Listen, have a great weekend, and enjoyed the discussion and appreciated your time this morning.
Thank you both. Take care.
Take care.